There we go. Let's get rocking and rolling. Today we are talking about the three foundational constitutions of constitutional iridology. And so as we do this, there's going to be a lot of information, and we're also going to be doing case studies. So I'd love to see some interaction here, just to make sure you're still with me and that it's making sense. Right? That's really important. You know, I do these free webinars, yes, as promotion for my course, but these free webinars are not worth a blinking penny if they don't make sense to you. Do you agree that what you see here needs to make sense? If you agree with that, give me an oh yeah in the comments box. That you want to learn something that you can use and it needs to make sense. Just because it's free doesn't mean it shouldn't make sense, right? Right. Okay, let's rock and roll. Again, take a moment to introduce yourself if you haven't already. I love getting to know who's with me, and I love getting to know what your background is so that I can tweak this presentation on the fly. That is so important to me. Thank you for spending the next 45 minutes or so with me today. The information we're going to cover today is meant only for your education. It's not meant to diagnose or prescribe. You are responsible for any results, good or bad, that you get from using this information. Just by way of introduction, my name is Judith Cobb. I am a master herbalist, natural nutrition clinical practitioner, and I am a certified iridology instructor and a certified iridologist. Now, this is an important distinction nowadays, right? The International Iridology Practitioners Association, up until July of this year, had one program. It was called the core curriculum. It was divided into two levels, level 1 and level 2, and you needed both of those levels in order to certify as an iridologist with them. That was only one of the requirements to become certified. In July and August, they introduced a level 3. Out of all of the certified instructors worldwide, there was only about 15 of us who took the level 3 course. And so far, there are only 4 of us who are certified level 3 instructors. Yes, and I have achieved that goal of becoming a level 3 certified instructor. So that is very cool. And I am really happy to be in that very elite group. I got into holistic healing over 40 years ago, over 4 decades ago, because I had some health problems and the medical world was not solving them. I didn't know anything about holistic healing, but you know how life is. It presents us with opportunities, and it presented me with the opportunity to branch into learning, to studying and learning and experiencing holistic health. Over my years in this industry, I've written many books that were self-published and self-distributed. They are all out of print right now. Pregnancy Naturally, the Herbal Birth Kit Handbook, Healthy Kids Naturally, The Essential Guide to Nature's Sunshine Products, Biokinesiology and Color Therapies Level 1 and 2, and the Dynamic Iridology textbook, which is the textbook we use in my iridology course. I've also created and taught many courses. Way back when I first started out, we didn't have the internet. Some of you may not have been around when there was no internet, but there was no internet. We thought we were pretty cool when we had a fax machine. All right, now if you're laughing, that's okay. That's okay. So back then, there weren't a lot of classes available. We didn't have the internet. There were even very few good books available. And so I created and taught a 20-hour program on how to use herbs in your home. And we were talking about herbs that were commercially prepared and commercially available. We weren't talking about making your own blends or harvesting or drying or making your own salves or anything like that. It was just, what can you find in a health food store and how would you use it? That course was so popular that those students wanted more. So we created a 16-hour course that was about how to understand herbal combinations, so that when they went to the health food store and they found a pre-made combination, they could figure out what other things it could be used for and that was very, very popular as well. From there, I went on to create Biokinesiology and Color Therapy, level 1 and level 2. Some of you might know BioK as muscle testing. I've also been a certified prenatal educator for a few years with the ICEA. And so I designed and taught prenatal classes, and I still love doing fertility prenatal work. That's just where my heart is as far as clinical work. And of course, I've designed a course that meets the IPA requirements for curriculum, and it is called the Dynamic Iridology Assessment System. I'm going to invite you to stay with me to the end of today's workshop to learn more about the course that is starting on February 9th. A little bit more about me. I am a professional member of the Canadian Association of Holistic Nutrition Professionals and a professional member of the Canadian Association of Natural Nutrition Practitioners. I am also a professional member of the Alberta Herbalists Association, and each one of those things requires that I present credentials, proof of training, in order to be a member of those groups. So these aren't just social clubs, right? These are professional organizations that give us the right to do various things that we wouldn't be able to do if we weren't a part of this. Again, I started in this industry, started studying in 1979. And became a holistic practitioner in 1981. And I've accumulated many credentials over the years. Probably my most important credentials are that I'm the wife of 1, the mom of 7, and the grandma of 8.5. Yes, we have another grandbaby due this summer. We're pretty excited. So as we go through today, I'm going to try to keep my eyes on all of the screens. I've got my phone and the Facebook group and of course this webinar going. I'll try to keep my eye on everything to keep up with any chat that I need to be involved in. And I will tell you though that when I first started out in this industry, I was doing Jensen Iridology. And after about 10 years of that, I was ready to throw in the towel. It wasn't working. It wasn't working the way they said it would. And so again, you know, life has a way of presenting us with opportunities. I was blessed with the opportunity to begin learning constitutional iridology, and that really changed the way I do things. It's an amazing thing. Constitutional iridology helps me do faster and more accurate assessments with my clients, which is great. It helps me develop better and faster rapport with my clients. And it also eliminates the need for an intake form, right? It helps me create my programs more quickly as well. And that is a good thing. I don't spend a lot of my own time developing programs. I can do that all when I am actually with my clients. So are you ready to dive into this? Are you? If you're ready, let me know. Give me a ready in the comments box. We're going to start with defining, and Tina Marie says, yes, thank you, Tina Marie. I appreciate, and Peggy says ready. Thank you, Peggy. Appreciate that. We need to start off with defining what do we mean by constitutional iridology. You're going to see a lot of different styles of iridology out there. You're going to see a lot of people making a lot of claims. So we need to separate constitutional from everything else that is out there. Truly, we do. Constitutional iridology is a system for understanding the physiological/chemistry differences and potentials for differences between people who have blue eyes, mixed eyes, and brown eyes. Because there are some fundamental differences that we typically see, and beyond that, we know that there are some inherent predispositions, and it's those inherent predispositions that are so important for us to understand, because they can really give us a shortcut, if you will, to understanding what our clients' needs are. Are you ready to start looking at this? Let's start looking at blue eyes. I want to know, do you know someone who's got blue eyes? If you do, give me blue in the comments box. Do you know someone who's got blue eyes? Peggy does. Yeah, I think Peggy even has blue eyes. I know Peggy. Okay, so as we're talking about these eyes, I want you to think about the person you know who has blue eyes. Okay, and see if you can see them in this. So we're going to look at a couple of different eyes as we talk about the qualities, and then we just might do a case study. Sound okay by you? All right, hang with me here. Blue eyes have a special name. We call them lymphatic. Lymphatic eyes always have some blue. Now, they don't need to be completely blue like this eye is. They just need to have some blue. And witnesses on Instagram, thanks for saying blue. Appreciate that. When we have any amount of blue in an iris, not in the sclera, but in the iris, and when we see areas where there's at least a little bit of fiber exposed, that is a lymphatic eye. Now, there can be other colors. We're going to look at an example of an eye that has other colors in here, but what we need to remember is some blue and some fibers. If we see some blue and some fiber in the iris itself, it is a lymphatic eye. We know instantly that these people have an inherent tendency towards certain health concerns. Those health concerns center around mucous membranes and the lymphatic system. So when we're working with someone who has lymphatic eyes, we want to be asking questions. Iridology is not about us telling a client what is wrong with them. It drives me nuts when people post eye pictures and say, tell me about my health. No, you tell me about your health and I will tell you why your health is that way. Right? That's what iridology is about. It helps us understand why the client has symptoms they do. And that helps us to understand what needs to change in their diet and their lifestyle to change their symptoms. Does that make sense? If that makes sense, give me a thumbs up. Okay, let me know that that made sense to you. So when we are looking at the blue eyes, and Tina's saying, sure, thank you, Tina, and so is Peggy, wonderful. When we see someone who has lymphatic eyes, the very first question we ask is there a personal or family history? Because remember, what we're seeing in the iris is inherited. Is there a personal or family history of asthma, allergies, arthritis, eczema, psoriasis, kidney issues? Those are all situations that come from being high acid, which is another way of saying high mucus, right? We also will sometimes see issues with thyroid and parathyroid imbalances, because if someone is running too high acid, they burn out their calcium and magnesium. And then thyroid, parathyroid have nothing left to assimilate or to help us regulate with our calcium balance, right? So we also with thyroid or with lymphatic eyes want to ask the question, is there a personal or family history of thyroid or parathyroid issues / bone health issues? Now, I hope that what you're seeing here is that with iridology, it's not a one marker equals one problem. And you need to understand anatomy and physiology at a deep level in order to really dive deep with iridology. Let's look at another example. Again, we always have some blue. This has a very steely blue in it, a gray blue. Remember, there's many shades of blue, right? You can have blue, gray, steel gray, lavender, violet, baby blue, might even be a slight greenish tinge, right? Remember back to kindergarten that green, blue plus yellow is green. So we know we've got that blue undercurrent when we have a green eye. Remember, we always have some visible fibers here. It doesn't matter what shade of blue it is in the iris, we always have some fibers visible. We can have other colors like we do in this eye, and that's perfectly fine. Those colors teach us about other things that we need to understand about this body. They point us in more directions of questions we should be asking. So regardless of what other colors we see in an eye, our very first questions are always, is there a personal or family history of asthma, allergies, arthritis, skin conditions, think of eczema and psoriasis especially, or kidney problems, and is there a personal or family history of thyroid, parathyroid, bone issues? Okay, And that is the foundation that we start from when we are asking questions. Alrighty, so would it be okay if we actually did a case study? You want to look at an actual client of mine? If you do, give me an okay in the comments box. And while you're doing that, thanks, Peggy, you are hot on that okay button today. And Tina is saying oui. I speak about 4 words of French, Tina. I know oui. So merci beaucoup. Do you see how even that much is going to point you in a good direction in working with your clients? And J.E. Olguin is saying, okay, thank you so much. Let's look at this case study. This is a female in her mid-30s. She is very clearly lymphatic. You can see the blue, you can see the fiber. We are going to add a few other distinctions. She is also what we call polyglandular, and I'm going to see if I can angle my phone better for my Instagram people. She is also polyglandular. And I'm hoping you can see the wrinkles in her eyeball coming around here. She is also anxiety tetanic. Whoops, I did not mean to do that. Just a moment. I hit the button and that's not what I meant to do. There we go. All right. She has a very tight collarette. This collarette is very, very close to her pupil. And this is inherently placed. It is not going to move no matter what we do. So when we look at this, this is suggesting that she is predisposed to constipation and to poor energy production, and that she's an introvert. However, we know that that's what this suggests. We must always ask the client. We never tell, oh, you must be constipated, right? You're an introvert. We never tell the client that. We ask. So we would ask, tell me about your bowel movements. How frequently do you have a bowel movement? Do you ever notice any undigested food? What is the texture of the bowel movement? Have you ever checked your bowel transit time? Okay, all those kinds of questions give us information as to whether she's constipated or not. So we are always going to ask her questions. We never tell them how they're feeling. The reason we want to ask questions is because the eye is inherent and it shows us what their makeup is, what their tendencies are, right? However, they may have figured out a long time ago what their tendencies are. She may have figured out as a 12-year-old that having a good poop really hurt because she was constipated, right? And she may have taught to her mom, who was actually one of my clients. This is a 2nd-generation client of mine. And her mom may have said, well, sweetie, that's because you're not getting enough vegetables. I offer them to you and you don't eat them. You're not drinking enough water. You're not getting enough physical activity. And so this client may have, as a young teenager, gone, well, I'd sure rather eat vegetables than have problems going to the bathroom. So she may have implemented correct principles that may be helping her body to function better. And so we cannot say she's constipated because she may have figured that out a long time ago. Now, when this client came to me as an adult, because I did see her as a young child as well, but as an adult, her concern was that she was not getting pregnant. And so looking at her eyes and talking to her about her menstrual cycle and getting all the details, her eyes, she's polyglandular. That suggests that she is predisposed to some hormonal issues if we're not careful. Her body wants to be out of balance. So when we see that she is polyglandular, we want to ask her, what does she know about her thyroid? Has she had her thyroid tested? How did those results come out? We want to know about her pancreas. What about blood sugars? Are her blood sugars stable? Has she had her A1C or her blood sugars checked? We want to know about her adrenals. How does she handle stress? Does she have any inflammation in her joints? Has she ever struggled with anxiety or depression? And then we want to know about her menstrual cycles. How often does she have them? Is she aware of when she ovulates? Is she aware of having ovulation mucus? We want to know how long is her follicular phase? How long is her luteal phase? And she may not know those things. We may need to guide her in and teach her ways to gather that information. Now, this client has an amazingly clean diet. As a matter of fact, when we work together, I tease her and say, I want to move in with her because her diet is so good. It's better than mine. Mine is good, but hers is really good. It's organic, it's clean. And so when we look at her eyes again and we see that we've got a little bit of pigment in here, this is suggesting some leanings towards some pancreas issues, perhaps some blood sugar stuff, but she's balancing her diet really well. We see that she's, with her eye color, she's also prone to a few some allergic tendencies. And she is prone to some lymphatic stagnation. This doesn't say her lymph is stagnant, it says she's prone to it, but she's very active. She has a good body weight, a body weight that's appropriate for her height. And again, she is active. So her eyes are suggesting she's a little bit prone to some leaky gut. We can't diagnose that unless we're a medical doctor who can run the lab tests, but her diet is good. So I'm not concerned about the leaky gut. When we look in her nutritive zone, we see that she has some, what we call comb teeth, and we've got a bit of a dull edge to the pupil, which says she may not digest proteins very well. And so we wanted to consider that. We see that we've got a little bit of an orangish color hanging out a little bit in zone 3. And so that again says pancreas, blood sugars. Well, if the blood sugar is out of balance at all, that can really mess up fertility, right? So again, her blood sugars are nicely balanced. She has a very sound diet. When we look at both of her ovary reaction fields, what we see in them, and we've got one down here, and we've got one down here, is that we've got some fat fibers that are running through these and doing some interesting things, right? Now, these fibers are not going to move. We can't cleanse her fast or build her and make those moves. So we know that ovaries may, in and of themselves, have a question mark behind them. She also has scarred fallopian tubes. That won't show up in her eyes because that's not genetic, right? We see genetic tendencies in the eyes, and that's it. So we always blend what we see in the eyes with what the client wants our help with. And we cherry pick the markers that are going to support and give us information that help us to understand our client better. In our first appointment, and we've worked together for a few years, she now lives in the US, so we do her appointments over Zoom now, which is great. And when she comes back to Canada periodically to visit family, then we are able to get her in for a face-to-face. In her first appointment, we did a vitamin called Prenatal Pro with her, and that's the one we've kept her on because it has a good complement of B vitamins, which she needs because she's got contraction furrows. It also, the B vitamins in it are methylated, and that's really important because of this little pigment we see here. We also gave her some specific supplements to help support her nervous system and her adrenal glands, and we used some N-acetylcysteine to support her liver, her phase 1, phase 2 liver detox. Now, she has, as I mentioned earlier, scarred fallopian tubes. She did have the medical procedure called recanalization. And so after they did that, she conceived once and she miscarried very early on. I did suggest that she needs to increase her protein. That was the one lack in her diet, was her protein was a little shy, but actually in the fats as well. So we've had to build up her protein intake and build up her fat intake. And that's where we've started with her. And that's about how long the whole assessment took. The rest of the hour-long appointment was talking with her, getting to understand her, and getting that insight as to who she is and how she clicks. All right, did that make sense? If that made sense, give me a makes sense in the comments box. That makes sense to you? Just want to make sure we're keeping track of our Facebook group. All righty. And Tina Marie says very much yes. And Cheryl says yes. Excellent. Excellent. Yes. I love it. Love it. Love it. Love it. You're all giving me makes sense in the webinar group. Amazing. So it makes so much sense that And I'm going to throw in some comments that some of my students have made as we go along. This is Stephanie Morgan. Stephanie has a master's degree in education. I asked her, why did she take my course? And she said, I'd seen enough of instructors online to know you were the best teacher, the way you organize info, check for understanding, coach your students. Other instructors know their stuff, but you have the heart of a teacher. I wanted to graduate with understanding, not just knowledge. And that's exactly what I strive for, is I don't want you recognizing one marking is one thing. I want you understanding how the markings work together. And I want you understanding how that information helps you create a program, right? Because we're not going to give one supplement for one marker. So Tina's asking what kind of protein she had, if you know, plant-based or animal, that can be a difference. She was doing a little bit of both, just not enough of either. And so I encouraged her to increase both. And on her animal, I encouraged her to go free range organic, right? Because for her, with her blood sugar things, we really needed that little bit of animal protein for her. Good question. Thanks for asking. Here we have a hematogenic eye. You might know hematogenic by its other name, which is brown eyes. I want to know in the comments box if you have brown eyes. Do you have brown eyes? If you do, say yes. And if you don't, say no. I want to know who's got what here. In iridology, we call these hematogenic. And we've got some no's and some yeses. Amazing. All right. So we need to know, how do we determine hematogenic from a lymphatic eye? And you're going, well, duh, that's easy. Well, it's, you know, depending on the colors you see in a lymphatic eye, it may not be easy. In a brown eye, in a true hematogenic eye, we will have brown. We may have gold. We will have no visible fibers. So we look all the way around, and do we see any of those fibers radiating outwards? And Coach Susie has blue eyes. Fabulous. Excellent. And so if we do not see any fibers radiating out, and if the only color we see on the iris is blue and gold, then it is a hematogenic eye. So there can be no blue, no green visible. When we're working with a hematogenic constitution, their key points are going to be liver and blood. Liver and blood. So people with hematogenic eyes are more prone to having issues of things that originate with liver and blood. So spleen, stomach digestion, circulation and heart, varicose veins. Their pH tends to be a little more alkaline. In fact, we often need to acidify them a tad for mineral assimilation, because they tend to run too alkaline. They often don't carry a good calcium level. And because we need those minerals to keep the endocrine balance, their metabolism running well, again, we often need to build up their acid level a tiny tad. And you would ascertain that on an individual basis. You would ask your client the questions that would help you to understand if they're running too acidic or too alkaline. Right. And if you've got a hematogenic who's running too acidic, of course, you want to bring that down a bit. If you're working with someone who's too alkaline, you want to take them a little more acidic. So you need to understand how the body works and how nutrition works in order to dive deep and head in the right direction. Here's another amazing example of a hematogenic eye. This one falls into what we call the connective tissue category. We've got markings, we've got open weave in some of the eye, and it is distanced from the collarette. And so we know this is going to be a connective tissue type. So what do you say? Should we do a case study on hematogenic? If you think we should, give me Hema, H-E-M-E, in the comments. Tina's just saying yes, please. I love it, Tina. Thank you. That works. I'll take a yes, please, or a Hema, whatever works for you. Amazing. This is the niece of the woman we just looked at. Okay, this little girl is 2 years old. And I will tell you, it can sometimes be a bit challenging to get good eye photos of a young child. These are amazing photos for a 2-year-old, really amazing. She did such a brilliant job of sitting and just opening her eyes super wide so I could get in there with the camera. I was so impressed. She's just a darling little girl. These eyes are, just a moment, did I skip? Hang on just a second. Because these are actually not Hema eyes. I think that I thought I proofread these. Okay, we're going to jump over her because these are not actual Hema eyes. These are mixed eyes. We'll come back to her with the mixed. And I apologize that I do not have a really good Hema eye. Let's pop back to here. I know this person's story, so we'll talk about him instead. This is an Asian fellow in his mid-30s. Again, this is another fertility situation. He and his wife is also a lovely little Asian lady, came to me wanting to conceive. He, and she was the one who had actually PCOS and type 2 diabetes, right? And so we were working with her, but he wanted to know if there was anything he could do to enhance the situation. Well, his semen analysis was like rock star. His count was like 200 million. We're now looking at 15 million as being where we cut off for infertility. So 200 million, brilliant, just an incredible amount. And healthy, like he had like 5% that were really good morphology, and they were swimming well at immediately and at 60 minutes and even at 2 hours, they were swimming well. So his stuff was really good. His test results were amazing, but he still wanted to know what could he do that would help. Well, interestingly, his wife having type 2 diabetes and PCOS, we had to do a lot of serious diet work with her. And when we were going over the diet work that needed to be done, and I could see her eyes just, she was like, I can't do that. But she had to, because that was the only way we were going to balance her blood sugars. She'd already been to the fertility clinic and they had no results there at all. And so her husband was with her, and he just reached over and patted her hand and said, there, darling, I will take over all the food prep. I will make sure that we eat. Note the word we eat this way so we can have a better chance of having a baby. And so even though his blood sugars were actually very well balanced, and he's lean and fairly tall, he actually did the entire diet program with her for the duration of the 2.5 years we worked together. He lost about 20 pounds. And what he said specifically was he found that he was more competitive on the soccer pitch. In spite of the fact that he's in his mid-30s, he plays in a league that is for 20-year-olds, and he could keep up with them. And he found that by taking off 20 pounds, and he wasn't, to look at him, he was not overweight, but the work we did, it took off 20 pounds. His energy came way up. He wasn't falling asleep in the middle of the afternoon at his desk. And he said that he was now competitive again with the 20-year-olds, which I thought was just amazing, really, really fun. So with him, again, because we saw all of these open structures in his eye, there is the risk for him that his blood sugars could be unbalanced. So it was not the wrong thing to use a blood sugar balancing diet with him, not at all. And for what I see with a lot of my Asian clients is I see a lot of type 2 diabetes because they typically keep the white rice when they come to Canada, and they combine with that all the lousy, awful food choices that we have available, right? And so by cleaning that up tremendously, we did balance his blood sugars better than they had been ever balanced, took off the weight, and now we've reduced his risk of becoming a type 2 diabetic. Right? We actually didn't use any supplements with him because his sperm count was so amazing that we didn't need to. We may, if we've got time, we may come back and do this little case study as a biliary set. This is what one of the naturopaths said. He's taken my course as well. He's a naturopath, Mike Knapp in Arizona. You can look him up. I asked him, why did he take my course? He said, the interactive online platform with an experienced teacher and practitioner. You said the fundamentals of iridology could be learned in this format, and that's what was delivered, plus a lot more on how to integrate it directly into current practice. I'm very happy with the training, so thank you. So that's amazing. Again, teaching far more than just markers, right? Let's look at the biliary eye type. Now, this is a mixed eye. Now, this is interesting because you might call this hazel, but we need to know, how do we distinguish this from an hematogenic eye, right? So remember, with hematogenic, we said no fiber and no blue. With biliary, we will see no blue, but we will see fiber. Do you see this fiber down here? If you can see this fiber, these threads radiating outwards, I would like you to put I see in the comments box. Can you see that fiber? Yeah, Peggy's saying yes. That'll work. That'll work. Okay, so we call this a biliary eye. Now, as that name implies, and Cheryl is saying, I see, and Tina Marie gave me an eyeball. Good job, Tina. I'd like to know how to do those little emojis like that. I'm not good with that. Not yet. Maybe I'll learn one day. So with this, again, as the name implies, bilious, bio, and so we are, when we talk about this, the biliary eye type, we are talking about fiber. So Coach Susie's saying fibers with a question mark. Coach Susie, are you saying that you cannot see the fibers because of the camera? You see, I see, brilliant, you've got it, well done, got it. So when we see this biliary, we know that we are thinking about liver as our core question. That's going to be our main line of questioning here. Now, in a lot of the old Jensenian styles of iridology, they would look at this eye and they would look at how variegated it is. And they would say this person is full of toxins. This person needs a cleanse. If they do a cleanse, these eyes will turn blue. That is so not right. It is so wrong. It has been so disproven. It is not accurate. That is, I mean, I told people that for the first 10 years of my practice, and we put them through the paces. They did cleanses, they did fasts, they did herbal regimens. Never once did we see eyes like this turn any other color. Okay, so no blue, some fibers. So we see some fibers. They might have some white or green or gold in the contraction furrows as well. There might be gold highlights. There might be a darker area near the collarette or around the pupil. I mean, this is a perfect textbook biliary eye type. So our questions here are going to circle around personal and family history. Remember, we always consider family history here as well, because this is inherited. We need to ask about digestion, liver, gallbladder, and pancreas. All right. And so those are the types of questions we want to ask. You know, how's your digestion? Do you get burpy? Do you get farty? Are there foods you've learned to avoid because they sit heavily in your stomach? We talk about liver. Do fatty foods bother you? How well do you heal after an injury? How is your immune system? How is your iron in your blood? You know, what is your lipid profile like? Those are all indications of liver function. Gallbladder, again, fat digestion. Do fatty foods nauseate you? Do you have a pain in the upper right quadrant of your abdomen, just under the corner of the ribs there? Have you been told you've got gallstones? Pancreas, how's your energy through the day? Do you get sleepy at 2 o'clock in the afternoon? Do you crave carbohydrates? Do you find that you need caffeine to keep going? You know, those are the kinds of things. As a family member ever been diagnosed with type 2 diabetes, right? Those are the kinds of questions that we would want to be considering if we saw that. Now, we would ask those questions if they were appropriate for what the client wanted help with. If this client came in with migraine headaches, then yes, I'm going to ask him all those questions, because every one of those categories can tie into migraines. If this client came in with a skin issue, yes, most of those questions can tie into skin issues, right? And so we want to cherry pick the questions we are asking based on what the client has asked for help with and what we see in their eyes. The client does not need to know every single marking every time you visit with them, right? So important to not overwhelm our clients. Here's another great example of a biliary eye. Again, we've got no blue in the iris itself. We've got a little haze at the edge. That is not what we're looking at. We've got some fibers. If we look very closely, there's a few fibers poking through in various areas. We've got gold and we've got brown. And we've got that central heterochromia, that slightly darker color around the middle of the eye. So again, we're going to go back to that set of questions we asked on our last slide. And with this, again, it's important for you as we're looking at this to think, how would doing iridology this way help me work with my clients more effectively? How will it save me time? How will it help me to dig deeper? How will it help me to laser focus my recommendations for my clients? Because if it's not doing those things, then what good is it, right? Iridology can enhance your practice as a wellness coach, whether you do herbs or nutrition or you're a naturopath. Okay, so are you seeing how even knowing a little bit about their eye color can begin to direct you for the questions to ask and where to look for issues? If you are, give me a yes in the comments box if you see that clearly. Let's do a case study. Here's a lovely case study. Okay, I do have my pictures mixed up because this is hematogenic. All righty, that's bizarre. Let's do the hema, and then if we've got time, we'll pop back to the other biliary case. Client mid-50s. She'd actually been to me apparently 25 years previously, and I'd helped her with an issue. I don't keep records for 25 years. I keep them for 10. Apparently, I'd helped her in 2 appointments and hadn't seen her since. So she thought of me when she had this issue. She's got hot flashes and a history of depression. She's a psychologist, and so she knows what to do with a lot of the mental health stuff. She's learned to work with her mental health quite well. She's got a clean diet. She's using good quality supplements already. She drinks 1 cup of Turkish coffee per day. Remember, she has hot flashes. Women that are with us, if you are having hot flashes, pay attention here, okay? You're gonna get a free tip or 2 in this. She is hematogenic, which means she's got the brown eyes that we mentioned earlier, brown with gold and no visible fibers. She has radial furrows, which suggest some bits of potential for nerve interruption in things. We've got a brown pigment right here, which is telling us that liver wants to affect how certain organs are working in her body. This also suggests MTHFR, which again can mess up B vitamin metabolism. She's got clouding at the edge, which suggests liver imbalance. That is messing how her body handles her carbs, so that she's actually creating cholesterol and sedimenting it in her arteries, and probably triglycerides as well. When we see these blood vessels in the sclera, we know that her circulation is becoming congested, and based on where these are, tells us which organs are likely struggling. So again, her prime concern was hot flashes. As we talked, and I recognized that she was doing a lot that was good, daily activity, her diet's really clean, except for that Turkish coffee. I suggested that she might do an experiment. I invited her to give up the Turkish coffee for 10 days and see what happened. She gave it up, and then she went back to drinking it, and then she came back to see me. And as she said specifically, she said, I found that when I wasn't drinking the coffee, I had no hot flashes. I said, that's great. So what is your next move? She went, well, I do so much that's right. I don't drink alcohol, I exercise, I eat clean, I make good food choices, and I really enjoy my coffee. I'm going to keep drinking my coffee. I'll deal with the hot flashes. I'll just put up with them. Okay, so that made me sad that that was her verdict. But you know what? My job is simply to love and to teach. My job is not to browbeat. It is not to be pushy or obnoxious. She made her decision as an adult with full information. All right, let's look at the biliary eyes then. These eyes are biliary. Now, for those of you, you may not be able to see that there's actually quite an undercurrent of greenishness in here. Quite a bit of green in there. On Facebook, you might not see that. I'm not seeing the green come through on the screen. There are also areas like right in here where we can see fibers. We can see more fiber structure here. So this is biliary, 2-year-old little girl. Again, I know her mom well. I've worked with her mom since before she conceived this little girl. Worked with her mom as an adult. Of course, I worked with her as a child because, again, so this is now a 3rd generation client. Diet is excellent. It's organic. It's from scratch. There's almost no sugary treats ever. Loving, intact home. But the mom is concerned that this little girl is starting to have meltdowns. And so she's also getting more colds, which is not something that they've ever had before. She doesn't go to daycare, so she's at home with her mom or a nanny or the grandma. When we look at her left iris, definitely biliary with really nice fiber structure. Little anxiety tetanic in here. Now remember, anxiety tetanic says that she's going to burn through her B vitamins, vitamin C, calcium, and magnesium pretty quickly. She also has a little bit of netting at the limbus around her eyes, and the netting suggests that there might be an increased risk for allergies. And she has a bit of a constricted collarette, which means she's a bit of an introvert. Slight ferrochromatose as we look and we see there's some brown that radiates outward, which means she might have some issues with iron assimilation. When we look at the right eye, again, it's all just pretty much a repeat of what we see in the left eye. So what we did is I encouraged this mom, and this mom is doing such a brilliant job. She really is a conscientious, very on purpose mom. And I suggested that her mom get her involved in things like tumbling and dancing and painting and drawing and just all kinds of things that are creative that could help her express her emotions and her frustrations. We have a bit of a darker brown pigment sitting right in here, and that again could be MTHFR. We have right here a bit of a fermentation sign, which means she may not be handling her carbs properly. And so knowing that, we went very simply. The diet is good. We had mom pump up the protein and the good fats a little bit. That's a really common theme. And we also suggested using a liquid methylated B vitamin with her to make sure she is getting the Bs that she needs. So I asked Karen Choate, who's one of my grads, how iridology has helped her in her business. She is a certified natural health professional, and she specializes in gut health. She said specifically, iridology has helped me to organize the relationships between different organs and organ systems more in depth. Iridology also gives me an advantage of seeing the potential for underlying genetic traits and qualities that may be underlying. By observing the constitution, for example, you can extrapolate how the person's body will likely respond to applications of healing methods. Therefore, it has helped me to expand my knowledge and increased efficiency at providing more precise recommendations for health-oriented options. All right, so with that, I'm going to beg your indulgence for about 3 minutes to introduce the Dynamic Iridology Assessment System course. Our next course is starting on February 9th. It will be running from 12 noon to 2 p.m. for 20 weeks on Wednesdays. Registration, however, closes on February the 5th. If you're intrigued, if you're a health professional, herbalist, nutritionist, naturopath, a massage therapist, anyone who's got a good anatomy, a good base in anatomy and physiology, I encourage you to hop on over to tinyurl.com/iridology-insight and book a call to speak with me. This is not a call to strong arm you into anything. It's a call to find out if this is the right course for you and if this is the right time for you. Now, as we do this, just want to introduce that this course is the only live, online, fully mentored course for nutritionists, herbalists, and naturopaths who want to streamline their clinical work without sacrificing client care. Because I focus on teaching wellness professionals, we dive a lot deeper than we could if I was teaching the general public. So, and we do this so that you can stop working unpaid overtime creating protocols for your clients. Nutritionists are notorious for that. Stop overwhelming your clients with programs that are not manageable because you've spent 4 hours creating it. How can you deliver it in less than an hour and hope that your client's going to be able to accomplish this? And by creating simpler programs that are on target, it will increase your client compliance, success, and long-term retention. You've heard me talk about second and third generation clients and people coming back after years of being away. That's what we want to have happen. Why do I stipulate that this is for health professionals? Because people have a strong foundation in anatomy and physiology who've completed at least one college level course in anatomy and physiology find it easier to learn iridology at the depth that I am going to teach it. They understand how organs work with or against each other. And my course is designed to teach you more than one marking means one thing. It's designed to help you understand and think through how the organs and the body chemistry work together, the interplay of the different iris signs and the sclera signs as well, and pupil signs. It's been my experience that students who don't have a strong foundation in anatomy and physiology struggle and often drop out. That is not my desired result. I prefer to take on students who are health professionals, who've got the foundation, so we can dive deep. So if you are a health professional, oh, I love this. I'm going to read Peggy's comment in a moment. If you are a health professional who wants to learn iridology at a professional level instead of at a hobby level, then go ahead and schedule a call and let's talk. Peggy is a course graduate. She said, I did the course with Judith and she's so amazing. I'm so grateful. I look forward to more courses with her. She's hands-on and support continues from her even after the course. I'm so happy Judith came into my life. Peggy, that is so sweet. You've almost got me in tears. Thank you for that. Because yes, the support does continue after you finish your course, even after you certify. And we can talk about that in a phone call. So if you are a health professional and you're interested in either learning iridology or updating your skills, maybe you learned Jensenian, maybe you learned 3 decades ago and you need to update, you want to brush up on things and catch up on the newer research that's coming out, then reach out to me. Book a call, let's have a chat. tinyurl.com/iridology-insight. Book a call, let's have a chat. If it's the right thing, I will offer you the opportunity to get enrolled. If it's not the right thing, if there's some pieces missing, I will coach you as to what I would suggest would be the next thing that you need to do to get ready to come into an iridology program of this caliber. So with that, my friends, thank you so much for being with me today. I hope that you've picked up some things. Tina Marie says, yes, I have to add that. I'm really enthusiastic to keep following Judith. Excellent speech, explanations, and interactions. Thank you so much, Tina Marie. Really, you and I should have a chat. I would love it if you would book a call and let's talk about where you're at and what needs to happen next and how I can support you in that. Peggy says, have a lovely day. Thank you so much. I absolutely will. Do have a great day. I look forward to hearing from some of you on phone calls. Some of you may already know that you need to do anatomy. If you need a referral to an anatomy program, one that I have tremendous respect for, I don't get any commission for recommending it. I don't teach it. I just have respect for the people who've done this course because it's so solid. Reach out to me and I'll send you a link to that course so that you can get your A&P under your belt. I look forward to speaking with you. Tracy 7, you are more than welcome. I'm glad you were with me today. Thanks for being there. And we will see you next Thursday. If you are not currently getting weekly email invitations to join me on these webinars, please message me your email address and I will send you, I will make sure you get on the email list to receive notifications of these free trainings and so much more as things are happening. Again, I look forward to speaking with you soon. Make it a fabulous day. Talk to you later. Bye for now.